Every practitioner encounters an unexpected outcome at some point in patient care. It does not mean you are a bad physician. It happens even to the most experienced physicians. But it can be distressing for you and for your patient. So how do you protect yourself from risk and keep the physician-patient relationship healthy? Prepare your patients for the possibility of an unexpected outcome before treatment begins. When you develop a treatment or surgical plan, discuss the risks and benefits. Cover the most likely complications and side effects. Include any risk factors that could affect the success of your plan. A patient who smokes, for example, faces a higher likelihood of postoperative complications. With medically complex patients, talk through the treatment challenges. Explain that they may need a team of specialists and healthcare professionals. Involving your patient in building the treatment plan is crucial. It strengthens the physician-patient relationship and encourages the patient to participate actively in their own care. Invite questions. Ask your patients to speak up if treatment does not feel like it is progressing as expected. Tell your patient immediately if they are not progressing as you expect, or if the outcome differs from the expected result. Open, honest communication matters when a complication occurs. First, it is the right thing to do. Patients are entitled to know the details of their care. Second, honesty maintains the relationship by building a culture of openness and trust. It can also reduce the likelihood of a lawsuit. Many patients sue because they feel their physician has not been honest with them. They file suit to get answers to their questions. Here are a few risk management tips to protect you, your patients, and your practice. 1. When a patient is not progressing as expected, act immediately to determine why. Does more testing need to be done? Does the treatment plan need to change? Should you refer the patient for an additional opinion? Is the patient following the plan? A slow response can lead to patient injury through treatment delay, delayed diagnosis, or misdiagnosis. 2. Never let a patient talk you into treatment or surgery you believe is not in their best interest. Weigh the patient's history, risk factors, social history, and work when making treatment or surgical decisions. Discuss reasonable alternatives. 3. Coordinate care for medically complex patients. Communicate with the primary care physician, specialists, and every other practitioner involved to optimize care. 4. Determine your patient's expected outcomes. Are they realistic? Patient expectations often differ from yours. 5. Obtain verbal and written informed consent before treatment or surgery. Informed consent is an ongoing discussion, not a piece of paper. Use it to educate your patient about their care and the possibility of a complication. Disclose the facts to the patient and family promptly when a complication occurs. Hearing it from you is far better than hearing it from another provider or reading it in the medical record. Conveying regret and empathy is appropriate. Know your state apology laws. Most protect expressions of empathy, but do not cover statements that could be read as an admission of negligent conduct. Acknowledge how the complication has affected the patient. Discuss specific needs and any changes to treatment. All of it belongs in the patient's medical record. Presenting complaints and limitations. Medical, family, and social history. Physical exam findings. Referrals for diagnostic testing. Specialists or other evaluation. Your rationale for treatment decisions. Patient education. Reevaluations. Conversations with the patient and family. Communication with other healthcare professionals. Treatment progress. Changes to the plan. Informed consent. And the outcome of treatment. Proper documentation is a critical legal record of the care you provide. It is a valuable tool in your defense should a malpractice lawsuit be brought against you. We help podiatric physicians manage risk before it becomes a claim. For more information about communicating unexpected outcomes to patients, visit our website